Welcome, everyone. I'm Joe Calderoni from Mount Sinai, South Nassau. Welcome to our media briefing today about our latest Truth in Medicine poll, this time, once again, about people's attitudes in our area in both New York City and Long Island about the COVID and flu vaccines. Before we begin, we have with us Dr. Sharma, who is the president of Mount Sinai, South Nassau, and Dr. Glatt, Dr. Aaron Glatt, who is the chief of infectious diseases at Mount Sinai and also the chair of the Department of Medicine, and Dana Sanneman, our VP for Public Affairs, who's going to run us through the poll results. Before we do that, I just wanted to pause for a moment and remind everyone that 2.5 years ago, just about, we kicked off the Mount Sinai South Nassau Vaxmobile project. The Vaxmobile has brought more than 15,000 vaccines to communities in Nassau County in partnership with the town of Hempstead. I see Abby Fromm here today. She leads our clinical side of our Vaxmobile effort, and they've just done a terrific job reaching out to the community that we serve. We've actually gone to 30 different communities in Nassau County at 100 different instances in the last 2.5 years. So really been a terrific outreach program. And now I think I'm going to turn it over to Dana Sanneman to run us through the poll results.
Thank you. So again, this is our Truth in Medicine poll. This is a partnership that we have with Bethpage. This is our 16th public health poll, so we just like to thank Bethpage for their sponsorship of this important community health initiative. This particular poll, we were in the field in New York City and Long Island, so it's a metro area poll, 600 adults between October 1st and October 6th. And overall, there is a general sense that vaccines are important, so that's the good news. In all areas of all the adults, all the subgroups that we've reached, but only 15% of this 600 adults received the new COVID shot. So 70% agreed that the vaccines are important to their health, but a majority has not yet acted to receive the updated COVID vaccine. 75% of the respondents, so when we asked them before this new vaccine came out how many vaccines they received, 75% had one COVID vaccine, 44% said they had one booster, and 39% said they had two boosters. Now, only 39% said they're planning to get it. So 15% already got it, 39% said they're planning to get it. 25%, so a quarter of the adults surveyed, do not plan to get the latest COVID vaccine. 21% still undecided, so there is an opportunity for education in our community. Of those who are not planning to receive the vaccine, 24% said they don't need it. 20% think it is not effective, and 13% said there are just too many vaccines. The good news, and I know our doctors here will appreciate it, by comparison, 63% of the respondents typically get a flu vaccine, and 61% said they do plan to get the flu vaccine this year. Just going back to COVID, we did ask a separate question of parents, so adults with children under the age of 18, and 51% said their children did receive the COVID vaccine, but only 29% said they plan to get their children the updated vaccine. We also looked, other than COVID and flu, we also looked and we polled on the RSV vaccine, and I know Dr. Glatt will speak about that. 29% of our seniors who would be eligible for this vaccine heard of the vaccine, the RSV vaccine, and 27% said they would consider getting it. So this, though, keep in mind that 29% compares with 67% of respondents over 65 who typically get the flu vaccine, and 72% of our seniors over 65 who had the COVID vaccine. So that's just a brief overview. We do keep all the results on our webpage and on our Facebook page if you'd like to learn more. But I'm going to turn it over to Dr. Sharma now to talk a little bit more about the results and what it means for our community.
Thank you, Dana, and good morning. Right next door in the building next to me, we're handing out vaccines to the seniors that are the residents here. And this is our 6th stop this season And while you saw the poll numbers that Dana just shared, what I would say is it's actually been encouraging for us. Our experience has been a little different. We've given out hundreds of COVID vaccines as well as hundreds of flu vaccines, and there is certainly strong demand for this protection. And what I would suggest is that while the data on the polls sounds a little mixed, we see some encouraging data definitely on the flu vaccine numbers, as Dana shared, and maybe some less encouraging numbers on the COVID. But when you look at where we are with COVID, so many people have gotten COVID over the last few years, the urgency to get vaccinated has been diminished somewhat. I know there's a lot of discussion about vaccine fatigue. I don't think that's the major issue here. I think what's happened is the COVID vaccine specifically has been politicized. We don't see the vaccine fatigue with the flu vaccine numbers in the poll. So what I'm suggesting is really we should focus on the science, not on the politics. We know the COVID vaccine works. This specific iteration of the vaccine, we don't call it a booster anymore. It's now likely to be an annual vaccine, the way the flu vaccine is an annual vaccine, is a very good match for the circulating strains right now. So what are we recommending? We're recommending that high-risk people and people that live with high-risk people should consider the vaccine if they haven't had COVID recently. Now, to my right is Dr. Glatt. He's our Chief of Infectious Disease and our Chair of Medicine. He's going to help define the high-risk groups, and he's going to talk about a few other vaccines. All of these vaccines are very important for public health and for your individual safety. So we do recommend that if you are at risk, get the vaccine. Everyone should get the flu vaccine. The flu's not a fun disease to have. If you've ever had it, you'll know. So certainly getting the vaccine will help reduce your risk. And we do recommend the COVID vaccine as well. But to go into a little bit more detail as to which specific population should really work to get the vaccine, as we are seeing with our seniors, they are eager to get that, I'm going to introduce Dr. Glatt. Dr. Glatt.
Thank you, Dr. Sharma, Mr. Calderon, Ms. Sandeman. It's a pleasure to be here today to talk about something that is of fundamental importance to everybody, and that's their health. And vaccines remain a phenomenal way to prevent sickness. Now, not every vaccine should be given to every single person. And that's why I think that we do see sometimes in polls like this an accurate representation of what really is recommended as opposed to what is the baseline recommendation. And we're dealing, thank God, with COVID with a totally different world now because so many people have gotten vaccinated against COVID, so many people have gotten COVID, and those prior vaccinations and prior COVID infection provide still a great level of immunity. And that's why we're seeing, thank God, many, many fewer deaths, many, many fewer serious hospitalizations. And that in and of itself is probably playing a major role both from a scientific point of view as well as from a public health point of view as to why some people are a little bit more hesitant to get the vaccine today when they would have been very happy to have gotten it and did in fact get it in previous years. So let's talk about which people really should consider getting the COVID vaccination that's now available. So anybody who has not recently had COVID and falls into a high-risk group, they should get vaccinated with the new COVID vaccine. And that's because, unfortunately, there still are hundreds and hundreds of people dying every single day right now in the United States from COVID. And the people that are unfortunately succumbing to this illness are those that have the severe medical problems, underlying immunocompromising conditions, and just the fact that you're very old. How we define very old, I'll leave for other people to define, but in the highest mortality groups, when you hit 75, 80, 85, and higher, so then you fall into a higher risk category, even if you've been vaccinated in the past, and even if you've had COVID in the past. So for senior citizens, and for people that have significant underlying medical problems, I think it's very important that they get vaccinated with a new COVID vaccine. For people who don't fall into those risk groups, so then it's more of an option, do they wish to get vaccinated or not? The younger and healthier they are, the more difficulty there is to show that they will actually gain a tremendous benefit themselves. They will, of course, benefit other people if they don't get COVID or if they get milder COVID and are less contagious, so that will help people around them. So people that are living with immunocompromised people, people that are living with elderly parents or grandparents, people that work with those groups, so they're getting vaccinated not only helps themselves, but it will also help those high risk populations. So that's the nutshell about the new COVID vaccine. The flu vaccine is something that we've talked about on an annual basis. I think the first Truth in Medicine poll that we did, the Flues brothers. So we were introducing then to the public the importance of vaccination. And I think that most people do recognize the benefit. There is unfortunately a small population, a vocal population that doesn't believe in vaccines, but the vast, vast majority of people both get vaccinated and believe in the value of vaccines. And flu vaccine remains an extremely important way that we can prevent serious illness, especially in certain subgroups. Again, the elderly, senior citizens are more susceptible to serious influenza illness, flu illness. People that are very young are also susceptible. And pregnant women are especially susceptible. And those are the groups that we target while we target everybody to get flu vaccine. We have decades and decades worth of experience with the flu vaccine. It is a very good and safe vaccine. And when you consider how many deaths roughly are estimated each year related to the flu, we're talking about, on an average, the CDC says in the 30 to 50,000 area of deaths per year from influenza in the United States alone. That's a very good reason for people to get vaccinated, protect themselves, protect their family, protect their entire community, and certainly for healthcare workers to protect our patients. So the flu vaccine is available in a number of different formats. There is a nasal mist that people between the ages of 2 and 49 can take, and for everybody else, there's a shot, and they're all quadrivalent nowadays, and there's a special dosage for people above the age of 65, the senior dose. So we really are trying to target the individual populations in the best way that we can to make sure that we get as much flu vaccination as possible. One of the misconceptions about vaccines is that they prevent illness. Now, that's true for some illnesses, but it's not true for the respiratory types of illnesses. Where there, it may prevent it, but you may still get it, but you'll get a much milder form. And there's studies after studies that show that people with flu vaccination, if they do get flu, they get much milder illness. And that's something that's an extremely important benefit that sometimes is misunderstood or mislooked. And finally, this year, for the first time, we actually have 2 new vaccines against RSV. RSV is respiratory syncytial virus, which is asked very often, how come I didn't hear about this in the past? Well, one of the reasons you probably didn't hear about it was because we didn't test for it as much as we're doing since COVID came into place. And we also had no real effective treatment for it, with the exception of some neonatal illness for which we did have a monoclonal antibody in the past. But now, this year, for the first time, the FDA has approved 2 vaccines that are very effective in preventing serious illness from RSV. So here, RSV is different than both COVID and flu in that we're not recommending it for everybody. We're recommending it for people that are above the age of 60, but even there, I think one can target people above the age of 75 and older who really have potential serious illness from RSV that a healthy person who's 65, 70 probably is not at great risk. But the official approval is for people above the age of 60, and everybody above the age of 60 should sit down with their physician and have a discussion. Is this a vaccine that's appropriate and good for me to take, or is it something that I probably don't need? I don't think anybody will get hurt from this vaccine if they take it if they're above the age of 60, but it may not be necessary for every single person above the age of 60 to take it. Now, one of these 2 new RSV vaccines is also indicated for pregnant women. And that's because one of the most serious complications of RSV is in brand new babies that are born. And when you give mommy the vaccine between the ages of 32 and 36 weeks of her pregnancy, she will develop antibody that will be transmitted from her body through the placenta to the baby. And the baby will be born with protection from mommy against RSV. Now, this is critically important because RSV is a significant major cause of very serious illness and even death in brand new babies. And that's why, for the first time, we now have something to give these babies immunity from mommy. And all pregnant women should have this discussion with their obstetrician to say, should I or should I not get this vaccine? Again, we recommend giving it between weeks 32 and 36 of pregnancy while mommy is pregnant. And this has been shown to have a protective benefit to their babies and can save their babies from some very serious illness and even, heaven forbid, death. And finally, there is a new medication that's now available as well. It's not a vaccine. It's an intramuscular injection of something called nirsevimab. Nirsevimab is a monoclonal antibody. Everybody became familiar with these words because of COVID when we treated so many patients at Mount Sinai South Nassau with monoclonal antibodies, which were, in my opinion, very, very effective and life-saving in some situations. So we now have a new monoclonal antibody, this nirsevimab, that can be given to little babies once they're born and haven't gone through a flu season yet. So babies that are under about 8 months of age have not gone through a flu season. So babies that are born now and babies that are under the age of 8 months can have the parents discuss with their pediatrician, is my child appropriate to get nirsevimab or not? Now, this is a very popular already monoclonal antibody, and there are some shortages of it already. And therefore, in situations with the shortages, we would probably prioritize to give this to premature infants, give this to infants that have underlying medical problems, because most babies who get RSV will do okay. A significant percentage get sick. A smaller but still very significant percentage require hospitalization and even sometimes ICU care. And again, it's tragic whenever a child dies, but a small percentage of them will actually die, and they can be perfectly healthy babies, and heaven forbid they can die from this illness. So this is something that's critically important for pregnant women to discuss with their obstetrician, and for mommies that have given birth to have a discussion with their pediatrician. Is this monoclonal antibody, a single injection, appropriate for my baby or not? And the hope of all of these Truth in Medicine polls is that we can influence public health, that we can make a difference. At Mount Sinai, South Nassau, we want to make a difference. We'll find a way to make a difference, and the Truth in Medicine polls is just one way that we do that.
Thank you, Dr. Glatt. We always learn a lot whenever you speak, and thanks, Dr. Sharma, as well. Any questions from News 12? Anything for us? You're good? Okay. Dr. Glatt, just remind the lay people among us, quadrivalent?
So the only vaccines that are now available are all quadrivalent. So that means that there's 4 different strains inside of them that are guesses always, but they're pretty good guesses as to what's going to be the prevalent strain that's running around. But I stress to people, don't even bother reading all the numbers that are put out. It's 40% effective, 60% effective, 25% effective. It's relatively meaningless, because the bottom line is if you get vaccinated year after year, you are building up immunity, and you will probably not get serious influenza illness, which is the bottom line. You may get a cold. You may have some mild symptoms, but you'll be symptomatic for a shorter period of time, and hopefully, thank God, you won't get very, very sick. And again, influenza is a major killer. So if we can prevent that in our older population especially, we've done our job.
So just recap for us what we're seeing in the hospital in terms of COVID. We, in fact, are not seeing very many serious cases.
So again, we're very fortunate and blessed, albeit it was so unbelievably terrible in the previous years. But at this point in time, because of vaccination, because of prior COVID illness, we are seeing a relatively small number of patients in the hospital. And in that small group of patients in the hospital, thank God most of them are not very seriously ill. And we, thank God, aren't seeing deaths in our hospital. But again, I want to remind people that we are seeing hundreds of deaths across the United States each day. It's not a phenomenon that we've gone away from. So COVID is still a very serious illness, albeit, thank God, we are in such better shape than we were a year ago and certainly 2 and 3 years ago.
Thank you, Dr. Glatt. I think we have Perline. Did I pronounce that correctly? Perline, a local resident, has signed her HIPAA rights away, her worldwide rights of privacy, and I think she's available and going to get the vaccine. Is that the plan? Excellent. Thank you. Thanks, everyone.
I just want you to relax your arm. Give them a shot.